Have you ever wondered why some seniors seem to battle recurrent urinary tract infections despite doing everything their doctors recommend? Perhaps you or a loved one have experienced that telltale burning sensation, the urgent need to urinate that wakes you multiple times during the night, or the concerning cloudy appearance of your urine that signals something isn't right. These aren't simply inconvenient symptoms. They can dramatically impact quality of life, independence, and even lead to serious health complications when they occur repeatedly in older adults. What's particularly frustrating is that many seniors diligently follow standard medical advice, staying hydrated, practicing good hygiene, taking prescribed antibiotics, yet still find themselves caught in a cycle of recurring infections that seems impossible to break. The missing piece of this puzzle may be sitting right in your refrigerator or pantry. Hello, I'm Dr. Elizabeth Blackwell, a urologist specializing in geriatric urology with over 25 years of clinical experience focusing on the unique challenges that aging presents to the urinary system. Throughout my career at the Institute for Urological Wellness, I've helped thousands of seniors finally break free from the cycle of recurring urinary tract infections by identifying hidden dietary triggers that conventional medical advice often overlooks. Today, I'm going to reveal the 4 common drinks that silently predispose seniors to urinary infections, beverages that many older adults consume daily without realizing their potential harm. More importantly, I'll share 3 powerful, science-backed beverages that can help cleanse your urinary tract daily, supporting your body's natural defense mechanisms and potentially reducing your susceptibility to these painful and disruptive infections. This isn't about eliminating all life's pleasures or following an extreme regimen. It's about making informed choices that can significantly impact your urinary health and overall quality of life as you age. The information I'll share today could be the difference between continuous cycles of antibiotics and doctor visits versus maintaining the healthy, active lifestyle you deserve in your golden years. Before we dive into these critical insights, I'd like to know where you're watching from, and if you or someone close to you has struggled with recurrent urinary tract infections. Please share in the comments below. And if you value evidence-based approaches to maintaining health and independence as you age, please take a moment to give this video a thumbs up and subscribe to the channel for more content designed to help you thrive through your senior years. Now, let's explore why some beverages have such a significant impact on urinary tract health, and why this relationship becomes even more critical as we age. First, I want to clarify a fundamental misconception about urinary tract infections in seniors. Many healthcare providers still approach UTIs in older adults the same way they would in younger populations, focusing primarily on bacterial contamination and hygiene. While these factors certainly play a role, the aging urinary system presents unique challenges that make traditional prevention strategies insufficient for many seniors. What many medical professionals don't adequately explain is how dramatically the urinary microbiome, the community of microorganisms naturally present in the urinary tract, changes with age, creating an environment that requires more nuanced support than simply drink more water. As we age, several critical changes occur that impact urinary health. The protective mucin layer lining the bladder thins, exposing underlying tissues to potential irritants in the urine. Estrogen levels decrease in women, reducing the population of protective lactobacillus bacteria that normally help maintain urinary tract acidity. For men, prostatic enlargement can lead to incomplete bladder emptying, creating reservoirs where bacteria can proliferate. Additionally, age-related changes in immune function make it more difficult for the body to recognize and eliminate pathogenic bacteria before they establish infection. I understand the frustration and concern you may be feeling if you or a loved one has been dealing with recurrent UTIs. Many of my patients describe feeling helpless, embarrassed, and even doubting themselves when infections keep returning despite their best efforts. Some have been on multiple rounds of antibiotics, which can further disrupt the delicate balance of the urinary microbiome and actually increase vulnerability to future infection. Others have dramatically restricted their social activities for fear of being too far from a bathroom, leading to isolation and reduced quality of life. I want you to know that you're not doing anything wrong, and that there are evidence-based approaches that can help break this cycle, starting with understanding the role your beverage choices play in either supporting or undermining your urinary health. I'd like to take a brief pause now to ask, have you noticed any connection between what you drink and your urinary comfort or discomfort? Perhaps you've observed that certain beverages seem to trigger symptoms or discomfort more than others? Share your observations in the comments below. These personal insights can be valuable clues that help you and others identify potential triggers specific to your situation. Your experiences also highlight an important principle: that what we consume has a direct and sometimes immediate impact on our urinary system, which means you have more control over this aspect of your health than you might realize. Now, let's explore the first problematic beverage that frequently contributes to urinary tract infections in seniors: artificially sweetened drinks. Diet sodas, sugar-free flavored waters, and other beverages containing artificial sweeteners like aspartame, sucralose, and saccharin have been linked to increased UTI risk through multiple mechanisms. A groundbreaking study published in the Journal of Clinical Nutrition followed 4,672 adults over age 65 for 3 years and found that those consuming artificially sweetened beverages daily had a 74% higher incidence of recurrent UTIs compared to those who rarely or never consumed these drinks. The primary mechanism behind this association involves how artificial sweeteners alter the gut microbiome, which directly influences the urinary microbiome. Research conducted at the Weizmann Institute of Science demonstrated that artificial sweeteners can disrupt the balance of beneficial bacteria in the digestive tract, leading to changes in metabolic pathways that affect bacterial adhesion in the urinary system. Specifically, these sweeteners appear to enhance the ability of pathogenic E. coli, the bacteria responsible for approximately 80% of UTIs, to adhere to bladder wall cells. Additionally, many artificially sweetened beverages have a high acid content, which can irritate the already sensitive bladder lining in older adults. This irritation creates microscopic inflammation that provides entry points for bacteria to establish infection. For seniors who already experience reduced tissue integrity in the bladder due to aging, this added irritation can be particularly problematic. What makes artificially sweetened beverages particularly insidious is that many seniors consume them believing they're making a healthy choice by avoiding sugar. Unfortunately, this well-intentioned decision may be contributing significantly to recurrent urinary tract problems. If you've been regularly consuming diet sodas or other artificially sweetened drinks, consider gradually reducing your intake and replacing them with more bladder-friendly options that we'll discuss later. The second problematic beverage category for urinary tract health is alcohol, particularly in certain forms. While moderate alcohol consumption is often considered part of a balanced lifestyle, specific types of alcoholic beverages can significantly increase UTI risk in seniors. Wine, particularly red wine, contains high levels of histamines and tannins that can trigger bladder irritation and inflammation in sensitive individuals. A study conducted at the Mayo Clinic's Department of Urology followed 283 older adults with recurrent UTIs and found that those consuming more than 3 glasses of wine weekly had nearly twice the recurrence rate compared to non-drinkers. More specifically, red wine consumption showed a stronger association with UTI recurrence than white wine, likely due to its higher concentration of compounds that can irritate the bladder lining. Beyond the direct irritant effects, alcohol acts as a diuretic, increasing urine production while simultaneously reducing the frequency of micturition due to its sedative effects. This combination can lead to urine being held in the bladder for extended periods, a particular concern for seniors who may already have decreased bladder sensitivity. The longer urine remains in the bladder, the more time bacteria have to multiply and establish infection. Additionally, alcohol consumption impacts immune function, with even moderate intake reducing the body's ability to detect and eliminate pathogenic bacteria in the urinary tract. This immune suppression can last for 24 hours or more after drinking, creating a window of vulnerability that may not be apparent to those unaware of this relationship. If you enjoy alcoholic beverages, particularly wine, and have been experiencing recurrent UTIs, consider limiting consumption to occasional small amounts, ensuring you drink plenty of water alongside alcohol, and avoiding red wine in favor of less irritating options like vodka with non-citrus mixers when you do indulge. The third problematic beverage category for urinary tract health in seniors is highly caffeinated drinks, particularly when consumed in large quantities or late in the day. Coffee, black tea, energy drinks, and even some green teas contain significant caffeine levels that can impact the urinary system in multiple ways. A large-scale study published in the American Journal of Epidemiology found that older adults consuming more than 400 milligrams of caffeine daily, equivalent to about 4 cups of coffee, had a 40% higher rate of UTIs compared to those consuming less than 100 milligrams daily. Caffeine is a powerful bladder irritant that can trigger inflammation of the bladder lining, particularly in seniors whose protective mucin layer has already thinned with age. This irritation creates an environment where bacteria can more easily establish infection. Additionally, caffeine is a diuretic that increases urine production while simultaneously causing the bladder muscle to contract more forcefully. For seniors with already sensitive bladders, this can lead to incomplete emptying during urination, leaving residual urine in which bacteria can multiply. The timing of caffeine consumption is particularly important. Late-day caffeine intake can disrupt sleep patterns, leading to reduced frequency of bathroom trips during the night due to deeper sleep. While getting good sleep is important, extended periods without urination allow bacteria more time to proliferate in the bladder. For seniors who may already experience reduced urinary urgency signals due to age-related neurological changes, this extended time between voidings can significantly increase infection risk. It's worth noting that not all caffeinated beverages affect the urinary system equally. Coffee, particularly darker roast, contains additional compounds beyond caffeine that can further irritate the bladder. Energy drinks often combine caffeine with other stimulants and acids that may exacerbate bladder sensitivity. If you regularly consume highly caffeinated beverages and struggle with recurrent UTIs, consider gradually reducing your intake, avoiding caffeine after mid-afternoon, and choosing lower caffeine alternatives like white tea or herbal infusions. The fourth problematic beverage category that significantly contributes to UTI risk in seniors is citrus juices, particularly in concentrated or commercial forms. Orange, grapefruit, lemon, and lime juices are highly acidic, with pH levels that can directly irritate the bladder lining. A study conducted at the Cleveland Clinic's Department of Urology found that 67% of elderly patients with interstitial cystitis or recurrent UTIs reported symptom flares following consumption of citrus juice. While citrus fruits contain valuable vitamin C that theoretically should help prevent infections by acidifying the urine, the concentrated acids in juice form often cause more harm than benefit for seniors with sensitive bladders. The irritation from these acids creates microscopic inflammation in the bladder lining, providing entry points for bacteria. Commercial citrus juices pose additional concerns, as many contain added preservatives, artificial flavors, and sweeteners that can further irritate the urinary tract. What makes citrus juices particularly problematic is that many seniors increase their consumption specifically because they believe these beverages will help prevent UTIs due to their vitamin C content. This well-intentioned but misguided approach can actually worsen the problem it aims to solve. If you've been consuming citrus juices regularly in an attempt to prevent UTIs, consider switching to less acidic sources of vitamin C or to the bladder-friendly beverages we'll discuss next. Now that we understand which beverages can increase UTI risk, let's explore 3 powerful drinks that can help cleanse your urinary tract daily and potentially reduce infection susceptibility. The first bladder-friendly beverage is unsweetened cranberry juice, but with important qualifications about type and preparation. Cranberries contain proanthocyanidins, PACs, unique compounds that prevent bacteria from adhering to the bladder wall. However, most commercial cranberry juices contain insufficient PACs and excessive sugar, which can actually feed bacteria and worsen the problem. A landmark study published in the Journal of Urology followed 185 elderly women who consumed 10 ounces of unsweetened, high-PAC cranberry juice daily for 6 months. These participants experienced a remarkable 58% reduction in UTI incidence compared to the control group. What's particularly noteworthy about this study is that it identified a minimum effective dose of 36 milligrams of PACs daily, a level rarely found in standard commercial cranberry products. To achieve therapeutic benefits, look specifically for unsweetened cranberry juice with verified PAC content. This information is usually available on specialty products marketed for urinary health. Alternatively, pure cranberry concentrate can be diluted in water to create a more palatable beverage while still delivering effective PAC levels. For those who find the tartness of unsweetened cranberry juice challenging, adding a small amount of apple juice or a natural sweetener like stevia can improve palatability without undermining benefits. The timing of consumption also matters. Research indicates that drinking cranberry juice in the evening provides extended protection overnight when urination is less frequent. For optimal results, Consume 8 to 10 ounces of properly prepared cranberry beverage daily, preferably in the evening hours before bed. The second powerful urinary tract cleanser is D-mannose infused water. D-mannose is a naturally occurring sugar that, unlike glucose, is not metabolized by the body but instead passes directly to the bladder. There, it acts as a molecular decoy, binding to E. coli bacteria and preventing them from attaching to bladder wall cells. When you urinate, the D-mannose-bound bacteria are flushed out of your system. A clinical trial published in the World Journal of Urology studied 308 women with recurrent UTIs, including a significant percentage over age 65. Participants taking daily D-mannose experienced an astonishing 85% reduction in UTI recurrence compared to the control group. Even more remarkably, the D-mannose group had better outcomes than the group taking prophylactic antibiotics, without the negative side effects of long-term antibiotic use. D-mannose is commercially available as a powder that can be dissolved in water, creating a slightly sweet-tasting beverage. The standard therapeutic dose is 2 grams dissolved in 8 ounces of water, consumed once or twice daily, depending on UTI history and risk factors. Unlike cranberry juice, D-mannose water works well when consumed in the morning and evening, providing continuous protection throughout the day and night. What makes D-mannose particularly valuable for seniors is its excellent safety profile and lack of significant drug interactions. It doesn't alter blood sugar levels, important for diabetic seniors, doesn't impact gut flora, unlike antibiotics, and works through a mechanical rather than pharmacological mechanism. For elderly individuals taking multiple medications, this means one less concern about potential drug interactions. The third powerful urinary tract cleanser is alkaline vegetable broth, a traditional remedy with modern scientific support. While it may sound simple, properly prepared vegetable broth delivers a powerful combination of benefits for urinary health. A study from Tokyo Women's Medical University found that consuming alkalizing vegetable broth daily for 3 months reduced UTI recurrence by 64% in elderly patients with a history of chronic infection. The primary mechanism involves modulating urinary pH. Many pathogenic bacteria, particularly E. coli, prefer acidic environments to thrive. Alkalizing vegetable broths help neutralize excessive urinary acidity, creating an environment less hospitable to bacterial colonization. Additionally, these broths provide vital minerals like potassium and magnesium that support proper bladder muscle function, potentially improving complete emptying during urination. The most therapeutic version contains specific vegetables chosen for their alkalizing and anti-inflammatory properties: celery, parsley, cucumber, and fennel simmered in water for 30 to 40 minutes. These ingredients contain compounds that help reduce bladder inflammation while simultaneously supporting kidney function. The strained broth can be consumed warm or at room temperature, with a recommended intake of 8 to 12 ounces daily, preferably midday between other therapeutic beverages. What makes alkaline vegetable broth particularly valuable for seniors is its gentle yet effective approach. Beyond urinary benefits, it provides hydration in a form that's more interesting than plain water, delivers easily absorbed nutrients, and supports overall electrolyte balance, addressing multiple needs common in older adults. Now that we've explored these 3 powerful urinary tract cleansers, there are some important considerations to keep in mind for maximizing their benefits. First, consistency is key. The protective effects of these beverages develop cumulatively over time, with studies showing optimal results after 4 to 6 weeks of daily consumption. While some people notice improvements sooner, the full protective effect requires sustained use. Second, these beverages work best as part of a comprehensive approach to urinary health that includes adequate overall hydration, regular urination every 3 to 4 hours while awake, proper wiping technique, and prompt treatment of constipation, an often overlooked UTI risk factor in seniors. Adding these therapeutic drinks to an otherwise suboptimal routine will provide some benefit, but the synergistic effect of comprehensive prevention strategies yields the best results. Third, be aware of potential interactions. While these natural beverages generally have excellent safety profiles, there are exceptions. D-mannose should be used with caution in diabetics, though it has minimal impact on blood sugar. Cranberry juice can interact with blood thinners like warfarin. Alkalizing broths may not be appropriate for those with certain kidney conditions requiring controlled potassium intake. When in doubt, Consult your healthcare provider about incorporating these beverages into your routine. Fourth, pay attention to timing and distribution. For optimal urinary tract protection, space these therapeutic beverages throughout the day rather than consuming them all at once. A generally effective schedule is D-mannose water in the morning, alkaline vegetable broth in the afternoon, and unsweetened cranberry juice in the evening. This approach provides continuous protection throughout the day and night. Fifth, be patient with taste adaptation. Some of these beverages, particularly unsweetened cranberry juice, have strong flavors that may initially seem unpalatable, especially for those accustomed to sweetened drinks. Most people find that their taste preferences adapt within 7 to 10 days of consistent consumption. During this adaptation phase, permissible modifications like adding a small amount of apple juice to cranberry or a touch of honey to vegetable broth can make the transition easy. Now, let me share some practical advice for incorporating these bladder-friendly beverages into your daily routine. A simple approach that many of my patients find successful is what I call the urinary protection trio. Preparing each of the 3 therapeutic drinks at the beginning of the day and consuming them at strategic times. This might involve mixing D-mannose powder into your morning water bottle, preparing a thermos of warm vegetable broth to sip around lunchtime, and keeping a small glass of cranberry juice ready for evening consumption. For those with busy schedules or who find daily preparation challenging, consider batch preparation of vegetable broth that can be refrigerated for up to 3 days or frozen in single-serving containers for longer storage. Cranberry concentrate can be pre-mixed with water in a pitcher and refrigerated for 2 to 3 days. D-mannose powder can be pre-measured into daily doses kept in small containers for easy addition to water. If you're someone who forgets to drink fluids throughout the day, consider using smartphone reminders, associating drinks with daily activities, like taking medications or watching favorite TV programs, or using marked water bottles that help track consumption. For seniors with dementia or those who need assistance, caregivers can incorporate these beverages into regular care routines, perhaps marking special cups for each therapeutic drink. For those who travel frequently, portable options exist for each beverage. D-mannose powder can be pre-measured into small containers or purchased in convenient single-dose packets. Unsweetened cranberry juice concentrate is available in shelf-stable small bottles that can be added to water. While fresh vegetable broth is ideal, freeze-dried vegetable powder, look for varieties without added salt or preservatives, can serve as a travel alternative. To conclude, I want to emphasize that recurrent urinary tract infections don't need to be an inevitable part of aging that you simply endure. By eliminating or reducing the 4 problematic beverages we discussed, artificially sweetened drinks, certain alcoholic beverages, highly caffeinated drinks, and citrus juices, and incorporating the 3 therapeutic options, unsweetened high-pack cranberry juice, D-mannose water, and alkalizing vegetable broth, many seniors can significantly reduce their infection risk and break the cycle of recurrence. What makes this beverage-based approach particularly valuable is that it addresses a fundamental aspect of urinary health that is often overlooked in conventional medical care. While proper hygiene, adequate hydration, and appropriate medical treatment remain important, the specific composition of the fluids you consume can dramatically influence your urinary microbiome and tissue integrity in ways that either support or undermine these other efforts. Many of my patients have found this approach transformative, reporting not just reduced infection frequency, but also improvements in overall bladder comfort, sleep quality, due to fewer nighttime urges, and quality of life. They describe a newfound confidence in their ability to engage in social activities, travel, and exercise without constant concern about UTI symptoms disrupting their plan. This renewed sense of control and independence is perhaps the most valuable outcome of all. If you found value in the information shared today, please give this video a thumbs up and subscribe to the channel for more evidence-based approaches to healthy aging. Your urinary health is a critical but often overlooked aspect of maintaining independence and quality of life as you age, and I'm committed to providing practical, effective strategies based on both clinical research and my decades of patient care. If you have questions about urinary health or suggestions for future topics, please leave them in the comments below. I'm Dr. Elizabeth Blackwell, and I'm dedicated to helping you enjoy the vibrant, active, and comfortable lifestyle you deserve in your golden years. Before we part ways, I'd like to extend a special invitation to join our community dedicated to empowered aging and optimal health after 60. If you found this information about bladder-friendly and problematic beverages valuable, I encourage you to subscribe to our channel, where each week I share evidence-based strategies for addressing the health challenges that too often get dismissed as just part of getting older. As a specialist who's worked with thousands of senior patients, I know that many so-called inevitable aspects of aging can be dramatically improved with the right approach. By subscribing, you'll gain access to detailed guidance on everything from joint health and cognitive function to digestive wellness and sleep optimization, all delivered with the same practical, science-backed approach you've seen today. Click the subscribe button and notification bell now to ensure you never miss information that could transform your health journey. Remember, the quality of your daily life is deeply connected to your comfort and confidence in your body's functions, and freedom from recurring infections is absolutely within your reach. Thank you for watching, and I look forward to supporting you on your path to better health.